got you to spend your whole day with
You can move the camera.
no.
If you
What
keep
got
it
you
left
to
and
spend
right.
your whole day here at an innovation in healthcare conference? To get ideas, great. You're generating the ideas, so yeah, that's great.
All right.
Share ideas. Hear ideas and share ideas. Oh, thumbs up. Are we ready to go? Oh my God.
We are live.
All right. Hey, everybody on the Google Hangouts. Welcome to the Alliance Healthcare Foundation Innovation in Healthcare Conference. You're here joining everybody here in the room. Thank you all for being here today. We're excited to have you and looking forward to a really productive, oh my God, another selfie. Oh, never mind, okay. Really looking forward to having a great day today as we go through our Innovation in Healthcare Conference, the Innovation Lab as a marketplace of ideas. Next slide. We're going to create, collaborate, and eventually innovate from those ideas. In an innovation, I don't think that's what I'm
Sorry?
Do you need something? Next slide.
Yeah.
So, good. I can give it to microphone to someone else. Really excited to present to you our board chair, Elizabeth Dreiser. She's been on the board for several years. She owns several different companies. She's one of those people that, I mean, she's brilliant. And she's always starting new companies. Like, gets a great idea, starts it out, makes it happen, and goes on to the next idea. And so I'm really excited to have her join us today. I'm going to have Elizabeth come and join us. Elizabeth's going to tell you a lot about what we're doing with innovation.
Actually, I'm here on behalf of the board of colleagues to stand. Ron Craig, our past chair, and looking around. Well, it's our committee member, James. James will want to just say about it. I guess that's the delegation from the board today. Actually, part of what we wanted to share what we were thinking when we started this initiative. It actually happened at a time when we really deeply trying to figure out how we could and ultimately, so, you know, that is ultimately also at the same time that we were, yeah, thank you. At the same time that we were launching this innovation, we knew that we had to do something else. And I just want to spend a moment talking about, many of you guys know that we also have a mission support program, and we really tried to figure out how we could make that as simple, as accessible, as distributed as possible. We know that there needs to be, you know, a continuation of all the good work that's already happening, and so I want to nod to that. I understand that many of you every single day are doing stuff that is validating. And so while we want innovation to recognize that, you know, it's from the perch of where we are that we're going to build and go forward. So that said, you know, for us, when we think about innovation, what we were thinking about and what we're thinking about still, and I think this is enduring, is how do we create better quality for those in need as we think about our constituency? How do we serve more people? How do we do what we're doing better, with greater velocity, faster in some cases, and at a much lower cost? You know, one of the things that we realize is that, and we all know this is not news, we can't spend our way out of this problem. You know, we've got enough capital, and we've got to figure out how to do what we're doing even better. And what are the leapfrog opportunities, you know, in the day-to-day grind that all of us face of, it's Monday, then it's Friday, and, you know, for many of you guys, you're busy running your operations. In some cases, for fragile organizations, you're worried about payroll. You know, it's hard to be super innovative. So we wanted to take you guys out of that space, at least for some, and put you in a place where, and I think to Nancy's credit and others, where you get a chance to really think beyond the day-to-day. So that's what we hope today will bring. So in terms of thinking about like what we've funded historically as a way to frame up what we're looking for in the future. And do we have that? Oh, perfect, what we've funded. So for a number of you may know that our first couple of grantees, Text for Babies was our first. And there what we were seeing is, the question we were testing is, can health education be distributed in a better way, more affordably, and with greater velocity, and more ubiquitously? How do we get more information out to people in need more readily? So that's a theme you're going to hear echoed. And the good news is the answer is yes, the data are in. And on top of that, this is one of those opportunities that we saw early on, and now we're fortunate enough to see that this has been adopted in the state. So this is one of those where I think Alliance, saw an early opportunity, a good partner, with all the attributes, that we look for in innovators, which is, passion, commitment, expertise, and they've been able to really do amazing things. Now, I will say that the path of innovation is often bumpy. I was just having a chat earlier with one of the folks here in the audience that it's rarely a straight line. And in fact, oftentimes you think you're going to go from point A to B, and there's this great sort of thing, you're in an innovative space when all of a sudden you're in it and you're like, wait a second, you feel like you're going in circles. And in fact, that's the sign where there's a better opportunity. The B thing you think you were going to do, there's often a C option, which is actually far better. So, sort of the innovation, we're going to go linear, but instead you go into the swirl and then you realize, oh, wait a second, there's something fundamentally even better than I thought when I started. And I think that's often the case. One app, the question we had was, can we aggregate the application process for the social benefits? The key things that moved me, and I think moved our board at the time that we had a cohort of really fantastic applicants to folks in need, at having to go to all of these different places and spend and waste so much of their time, and then the dignity that is often stripped of people as they go through that process. And so this was really as much about, folks may say, oh, we funded technology. I would argue that we funded taking, or at least our goal was to take out huge hassle, huge waste of time, not to mention the duplication of monies that are spent over and over and over again. And so that really was inspiring to us on the board. You'll see that there's a theme here emerging: better experience, i.e. better quality, access, cheaper, and when people get their benefits with greater velocity, that's a good thing for them and their families. CIE, I know that we've got a video coming, so I won't steal all their thunder, but one of the things that we saw here is we understand the value of coordination of knowledge. And the hypothesis here and the question is, can we get the same kind of lift in social services if all the social service agencies understand what's going on with their cohorts, and therefore can we get them better quality care, less expensively in many cases, and faster. So the more we know, the better the care providers and the service providers can intervene. And so that's how we think about where technology is a service agent to these other goods that we want for society. The UCSD wireless observed therapy, I will say this was the fastest vote ever on our board. And here, the opportunity that we see is it's very expensive to do direct observed therapy. And TB is but one of the use cases that this is an issue for. And so, to the degree that we're able to, in a way, this was sort of a hack of the history of having very expensive folks watch people take their medicine, which, by the way, inconvenient for the patient, right? Costly for the system. And, we end up with all kinds of other things that happen, compliance issues and the like, because of this hassle factor. So again, better, cheaper, faster. I mean, the velocity of this, and seeing this potentially extend out to other areas of interest. Thinking about Access Youth Academy, this is one where, some people in the community may have scratched their head and said, what were we thinking? This was a nod to the realization that the connection between poverty and health is profound. And all of you know it. We know it too. And the interesting opportunity was, this is a cohort of less people. So we have a smaller audience of players that, were able to get assistance. This is really a cohort of kids that are going to likely end up in Ivy League schools, and what the sort of trickle down effects are of that to their families, to their cousins, to their neighbors. What does this do when people that are in tough situations end up in great places, get a great education? And also, the other factor was debt-free. We were shocked at the opportunities that they were able to leverage with all kinds of other funding. So it wasn't just that they got a great college education, it's that they also were not encumbered by that education in terms of their debt. So that gave them way more options in terms of what they might do going forward. So that is, the social determinants of health, one of the facets here, and we made a non-technology oriented investment in really just youth in squash, and helping the Access Youth Academy get more kids. Basically, we are paying to expand the base of kids in that program. Solutions for Change, another organization. Here, the opportunity that we saw was that, we know that it's difficult for folks that are in troubled situations to get jobs and to reintegrate to society. And so the farm, we learned, not only was a great place to get some job education and experience, but also to heal. And, I think we were compelled by the opportunities for folks that farming is actually a healing, form of therapy. And that also, that the food produced would also feed their families, coupled with be available to schools and other local places. So those were, some of the things that we've funded. Diverse, and I think, the purpose of walking you through those is really to say that there is a wide set of options that we are interested in looking at. And so for those of you who've been here and have applied before, we thank you for doing so. For those of you who have been the recipients of our resources, you know that this is a partnership. We try to take our roles seriously and understand that there will be bumps along the road. Nancy and team are here to help you, not just when you get the award, but also there's a tremendous amount that comes afterwards. I mean, that's really just the beginning of a very long journey. Every single one of those grantees and programs and projects, I can tell you Text for Babies almost died a couple of times. It really is a commitment that we try to make, and I think that has paid off for us as an organization. So I'm going to turn it over. I think that we have a video. Yes? Yep. Maybe we have a video.
Give you an idea of one of our projects. It's called the Pacheco-Cha, and we're only going to run 3 minutes. Oh, sorry. We're going to run about 3 minutes of this video to give you an idea of one of our Innovation Award grantees. Scott is here today too, so it's going to be weird to hear your voice. Yeah. You want to like mouth along with it, so at least, okay.
Community information exchange builds networks for enhanced care coordination. Our goal is seamless care coordination that improves people's health outcomes by looking at both mental illness, disease, as well as social support network. Our goal is to work with all of these together and across organizations to understand what it is that a client's experience is. So what CIE aims to do is build a 360-degree client view. The idea is to build the largest real-time exchange with the analytical capabilities to understand the history of what's been happening to a client across various organizations. It'll be used by care coordinations and policymakers. We'll provide client history dashboards, we'll help manage trust networks, we'll provide incentives to share and use information, all in the process of understanding new delivery networks and helping funder collaboratives to support CIE-related projects. The goal is building long-term projects, not to fund specific case management systems and not to specifically replace anyone's case management system. What CIE does is really build a network effect. With a single interface, organizations will be able to access many different other organizations' information systems. So the idea is a hub and spoke model instead of a point-to-point interface model. CIE is part of a larger infrastructure of building San Diego's social service network. Starting in the bottom left, San Diego Health Connect is focused on medical records from hospitals, emergency medical services, those types of things. KIP, the Knowledge Integration Project, is the county service, and CIE is providing social service networks. When you combine each of these buckets together, they provide a view of an individual client, in this case, a homeless individual. It also links together with 211 for information and referrals. The goal is one person with a more complete view that anyone can access by still respecting all the privacy and security restrictions. CIE was awarded the Innovation Grant in 2011. We've done quite a bit of work since then. I was hired about a year ago. We've filed our nonprofit application. We've done all of the technical work, and we're now ready to go live in July of this year. So let's take an example. Let's assume that there's an individual, Larry, who's on the street. The homeless outreach team and the paramedics team, the ERAP team has run into Larry, and he says he wants help. They may take up to 2 hours trying to find out if they can find him in bed, how they can get him connected to a hospital. And ultimately, if he isn't able to stay off the street, we haven't really done much to help him. The goal is to understand that client's history so that you can make those decisions much faster, decide to take them to the hospital or to their case manager, connect them with the organizations that know him and know how to help him.
So that gives you an idea of just one of the programs that we funded and the work that they're doing, and a little bit about the progress that they've made. They certainly have brought on the first cohort and now are bringing on the second. Do you feel like you've done enough in terms of where the board is at with regard to this? Well, one more slide. Innovation Initiative for 2015, but I think you've got a good idea of what the board is looking for and what we at Alliance Healthcare Foundation are looking for when we launch this innovation initiative. So hopefully that's got like your creative mind going already. Now I'm going to kind of jump a little bit over to looking at in the next slide. That's me. I'm the executive director at Alliance Healthcare Foundation. Next slide. Okay. I just want to tell you that we are, if you have any questions about the work that we're doing, we're all over social media. We have the website where we try and really focus on all of our grantees and the people that we're working with in the community, so you can get an idea of what we're looking for there. You can find all kinds of information. We're on Facebook, so please go and like our page so that you get information that way as well. We use email. We know that there's all different kinds of ways to communicate with people and to reach out to people, and whichever way is your favorite, I hope we're there and I hope you find us. We're on Twitter, we're on LinkedIn, wherever it is, hopefully you will find us and we will find you. Today, as I said before, for Twitter, it is hashtag AHF Innovation. Let people get really jealous that they are not here working with you and with us. So I'm going to tell you a little bit about what an innovation lab is. I started hearing about this. I'm always trying to what's happening out there in our community? Hey, how are you? What's happening out there that's a new way to create ideas? Because when I'm working with a lot of y'all, you're so focused on the day-to-day. You're so focused on what's happening with your organization and how you're going to get to the next month and the next year, that it's hard to kind of get that time to step back and just be able to be creative. You know, like wind up your robot and just watch it dance for a little while. It's like we don't get to take that time to just be silly and play and be creative. So one of the things that's happening now, and probably has been happening, but now has a title called an innovation lab. They're actually 3-day long processes. So you can thank me later for not making this a 3-day long process, but what's really cool about them is that we're going to do a piece of it today, good so far, but what they do in these particular labs is they create the space to identify problems. That's what we'll do today. Develop that marketplace of ideas, begin to like cull down those ideas into top 3 kinds of thoughts and solutions. Then they start delving into the data, like really deep into the data. What does this tell us? Is this the right direction? Then they start kind of testing and creating solutions and seeing if they work. Like that day, that next day or the second day, they're like testing those ideas. Does it work? What are the problems? Let's create a cardboard replica of it and walk through as if it were something that we just created. And then they're able to say, okay, that didn't work, let's tweak this. And so then by the end of the 3rd day, they actually have 1 or 2 ideas that they can move forward to try and solve the particular problem that they identified. So now you wish I'd made it 3 days, I bet, right? But what we're going to do today is get as far as building that marketplace of ideas. So we're going to identify issues to address. Hopefully you've started thinking or came into the room thinking already about, wow, I hope we talk about this. Or in my organization, it's really important that we work on this, or that we identify this. Or it could just be, you know what, I don't think Alliance Healthcare Foundation knows what the heck is going on in our community, and I want them to know this is really big. So those are the kinds of things that we're hoping to create and collect in terms of our marketplace of ideas. We're going to explore and dissect those ideas. So that's what these side stations are for. We'll be moving into those later on today. And then identify the top issues. That's what your dots are for. You're going to get, yeah, it's one of those where you go around and you put the dots where you think it's important. Then that'll begin to create and lift up those ideas that are important to our community. The follow-up to that is, instead of having you be here for 3 days, those of you that are really interested in continuing on to explore a particular solution that comes up, I'm going to commit to bringing you together and doing that deep dive into the data to figure out what this is, to prototype a solution, and let's see if it can move forward. You know, if we're really great and creative and aggressive about this, we might get an idea that comes forward for the innovation initiative this year. If not, and it takes more time, it might be an idea that's really good to bring forward to the innovation initiative next year. But that's what we're really looking for, is what are the innovative ideas that sit in your heads that we can bring forward today to begin to collect that marketplace of ideas. So in order to do that, another one of the videos I want to show you is the last organization that we gave an innovation award to. That's done with the follow-up. Yeah, now we're going to this one. And that was Solutions for Change. And this is some of the work that they're doing with their aquaponics farms and a social enterprise venture that they have with the
Solutions for Change, thus our name, is about changing attitudes and rebuilding lives for homeless families with children. We believe that in order to truly
It's another one of those times where I get to like entertain you. You know, one of the things that we really tried to do or thought about doing was we wanted to get a video of these robots all like marching around. I wish that I had enough time. I would get y'all all to bring your robots into the middle of the room, turn them on, and then make them go. You're like, don't dare. Nancy, really, that's like one of the crazy ones. But can't you just see it, like all the different colored robots? Like, okay, just imagine. See, I'm getting y'all to be creative now, right? You're thinking like, what would you do with the robots? What if we turned them like facing out? Or we like put them in circles like we are and made them dance, right? See? You want to do it, don't you, Saeed? I know it. So, okay, so maybe we... I don't know, is this like payback for something I did, Kevin? Well, it's not like it's going wrong, right? It's just like it's being creative. It's like challenging. We're trying to be innovative here, you know, about what the heck do I do now? Yeah, but this, I think Elizabeth really gave you an idea of the different types of innovation initiatives that we're looking for. You know, what's really exciting to me is that they are all so varied. You know, some people, when I talk to you in the community, think, oh, does it have to be technology? Does it have to have like some form of technology? I hope that what you saw and what you've heard is that no. Sometimes technology might enhance your creative idea. A lot of where this idea came from was from some work that Dr. Brenner has done in Camden, New Jersey. And it's called hotspotting. Basically what he did was he looked at the Medicaid data and he said, why are all these people going to the hospital when they don't need to go to the hospital, right? What can I do to reduce the cost of care to these people? And what, he said, oh, look, if I really look into this data, it tells me that they're really in these two apartment complexes. Most of the people are coming from these two apartment complexes. If I put some services there, maybe they wouldn't be going to the hospital so much. And when he went to talk to the people, he said, do you think that the care you got at the hospital was worth $1 million this past year when you went 13 times to the emergency room? Was it worth $2 million when you went 20 times last year? And most of them were sitting there saying, no way, I just had a cold, or, I just had this ache, or I was just, whatever it was. And so that's how he said, like, if we bring these services to you, we have them right here in your apartment complex, would you use those services instead of the ER? And they committed to that, to do that. And they've saved millions of dollars. That's where our Project 25 here in San Diego comes from, is that very idea. Can we really provide services at point of contact that keep people from going to the emergency room? Millions of dollars saved. Where was the technology? Just in the data. So that's kinds of things that we're looking for. What are the things that are happening in your community with the people that you're serving? Some of you work in very small communities in a certain section of our whole San Diego or Imperial Counties area. Some of y'all work completely countywide. And I can quit talking and show you the video. Okay, here you go. This is Solutions for Change.
A lot of times you can stand up in front of kids and tell them you need to eat your fruits and vegetables because they're good for you. Well, until they get to learn more and engage more with that food, it doesn't matter how much you tell them it's good for them. They're not interested.
The key is how do we get this great food into the community? And so that led to a little experiment with the district. What if we could provide them with some of this great food and see how that goes?
Without that food, it's so hard for them to learn and stay focused. And so they are eating a high quality product, a good food that's filling their bodies and then fueling their mind.
Tastes really fresh, like really, really good. Doesn't taste old.
I'm pleased as an adult eating it, and I know my kids love it.
I think it's really cool that you have lettuce growing just 2 miles away and it's freshly grown.
Our aquaponic systems rely on what we call the aquaponic cycle, which is our fish creating waste, which is mostly ammonia. Bacteria in our system break down that ammonia and convert it into nitrites and nitrates, which are plant food. The plants then absorb the nitrates out of the water so it can return clean back to our fish. Our systems recirculate indefinitely. So these two commercial systems have been running for just over 2 years. We've never had to dump the water out and refill them. I've heard estimates that aquaponics uses between 90 and 99% less water than traditional farming. We start everything from seed here at Solutions Farms. We try to use organic seed whenever possible, and we seed 4,000 plants. So each week we seed 4,000 seeds into a tray filled with coconut coir and worm castings. The coconut coir is what we call a soilless soil. It has no nutritional value for the seeds. It's just a medium that we use to sprout the seeds in. Once the seeds are sprouted, they'll spend 14 to 21 days in our nursery or our germination room until they get large enough to be transplanted into our floating rafts. And as they grow, they'll get pushed down towards our south end or our harvesting side.
So we're above organic certified food. So it's top 1%. It is like the best food that you could put into your body. We're not dealing with a corporation here. We're literally growing this food, harvesting, and then that afternoon, the kids are eating this food.
It's huge for me that Vista Unified has made an effort to put organic produce and foods in our schools, because I think we need to start educating students early about healthy food choices, what organic means, and how that directly affects how their brain works and how they learn.
I strive to get a connection from the cafeteria to the classroom, and now that we can make that connection one step further to the community and into their family life is perfect. That's what will sustain these students.
Those partnerships that we get with community organizations, community businesses, everybody benefits from that. The kids benefit, the schools benefit, and the organization benefits. It's building that stronger community.
And we have the amazing opportunity to give our students that top quality, top-notch product that they really deserve. I think it says to those parents and that students that we care. And because we want to put the best quality product on the plate, we do care about it, their nutrition, their health, what they eat, and honestly, how they learn and grow. And I think that's the message we need to send each and every day. The product from Solutions for Change just helps us do that a little bit better.
So what's really amazing about that is that farm actually started as an idea that they had to actually provide soft skill workforce development for the clients that they serve in their homeless housing for the people experiencing homelessness. And they found that, they really did learn those skills. They learned how to show up on time, to be accountable, to meet their deadlines. But then they had all this organic food. What were they going to do with that? And that's when they started, well, let's get it out to the community. And now what we've funded is expansion of that. So potentially they're able to provide organic baby greens to all of the 5 school districts in the North County. So you never know where that seed is going to start. Oh, that was really bad. Okay, but anyway, so from there, I'm going to quit talking. I've definitely hit my mark. I'm going to introduce to you James Halladay. Like I said, he's new to our community. He has worked all over the world. And I was really impressed when he came to meet with me because he knew what an innovation lab was. He had actually run them in, where was that? Istanbul, yeah. Haven't even been there. But he had run an innovation lab there, so I'm excited to have James come and run this day for you guys and to really get your creative juices and thoughts going as we do our innovation lab. So James.
And we're live. Good morning, everybody. How are you? Have you settled into your seats? You're feeling pretty comfortable like that, yeah? I'm going to ask everyone to stand up and get your stuff. Sorry to ruffle your feathers. Because we're going to change sheets is the first thing we're going to do. I hope they're not too precious, but if you have your stuff, you'll need to take it with you because you're taking a short field trip. Any new seat is fine. If you want to go across the room, that's great. You'll probably bump into somebody that you know or don't know. Feel free to say hi on your way. But find a new seat. Yeah, you can leave the papers, the Post-its, the pens. Leave those in the chairs. Every chair's got one of those. So that small act served as probably just the first of many occasions today for you to introduce yourselves and get to know people, get to know the room. Let me start by briefly introducing myself, explaining this unique orientation of the room today, why we're sitting in this semicircle or horseshoe formation, and why these other chairs and stations are located around the room, and kind of the game plan for today that Nancy's introduced. I also just want to say thank you to Nancy and to Elizabeth for inviting me, for welcoming me. By way of introduction, personal introduction, I'm actually born and raised in San Diego. I went to elementary school in this area. I went to Oak Park, and then in Canto Elementary, and then Bell Junior High. I think my worldliness and thirst for travel started when I was in the IB program at San Diego High School. I graduated there in 1999, and then went off to Stanford for my BA. And that was quite an eye-opening experience to leave San Diego for college. And I had a chance to study abroad in college, as so many folks do. But for me, it was, I sensed in the time abroad that one couldn't just dip into a place for a short period of time, that you wanted to sink your teeth into something, whether that's a pressing global challenge, local challenge, or new culture. And for me, I spent time in Berlin for about a year in 2000, 2001. And I got the bug to be out in the world. And I told my folks and friends that I wouldn't be staying in the States for graduate school, that I'd be going abroad, and that I studied political science and history in college, and that I needed to be in Eastern Europe for my graduate work. And so after I graduated in 2003, I moved to Poland. I had friends that had told me, and professors, about programs in Poland and in Hungary that would be really exciting for me. I hadn't been to either place. I don't have roots, family roots in either of those places. But I set off, and I ended up spending more than a decade in Eastern Europe and Turkey, first in Poland and then Russia, and most recently in Istanbul, Turkey, where I've been the last 7 years. So just coming back to San Diego in the end of October of last year. So what are we, about 4 months in San Diego 2.0 in my life. I've done a number of things during that time abroad, but in coming back here, as Nancy mentioned, I'm working at an organization called the Education Synergy Alliance that's looking at how best to prepare public high school students for college and career. And it's a whole new approach to education in a very comprehensive way that's both on and off the campus, and involves a whole range of stakeholders, including family and teachers and administrators, but of course the business community and nonprofits. It's a really kind of holistic approach to education. And having been so far away from this place, I'm now excited to be sort of diving deep and local into a city and place I love. And all that, I think, connects with why I'm here today and the kind of work that I'm doing, which is to say that you are all engaged in very deep and I think local and pressing challenges that are your passions. And this is a day in which to roll up our sleeves and explore those passions, to share those ideas, and to shape ideas that could be part of the innovation initiative. But really to think, what is the next step in your personal organizational evolution? What are the things that you need of yourself, of others, that are there, that aren't there, that need addressing? And the hope is that in conversations today of various kinds, those topics, those needs, those curiosities, maybe even frustrations, opportunities will arise. And some of the answers, solutions is a very strong word, but I think the suggestion, the possibility of solutions will emerge from these conversations. And as Nancy said, this is part one of what would be a multi-phase, multi-day innovation lab that could unfold. So that thank you for coming here today in taking the first step. Thank you for taking hours, precious time out of your days and your organizations to be in the room today. So let me now orient us to the room itself and get to how the day works and what the engine of things is. Each of the stations you see around the room, there are 3 whiteboards with, I think, 15 or 16 chairs each on either side of us where we are right now. And right now we are in the this is the central gathering place. And these are the seats you're in right now. Don't need to be your seats all day. If you want to leave your stuff there, that's great, and it can be your seat. If you want to take your stuff, that's fine. The entire day is your day, meaning that if you need to get something to drink, have a snack, step outside, attend to business, that's just fine. The main point of today's work is to be as present as possible for the length of our time here in the conversations that we're going to have in different groupings of people. And so when you're here in this circle, it's to be present with everyone. And when we're in small group discussions, to be present there. And whenever you need to attend to the other things in your life that you need to attend to, that's also fine. So I think everyone's had a chance to look at the conference agenda. It's just on the material that you had when you walked in. It seems very simple, but I just want to briefly walk ourselves through it just so we're on literally the same page. There's a lot of flexibility built in here. But one thing that you'll notice is that the lunch break is, we've given ourselves a half hour explicitly here for a lunch break. We're going to break for that time for lunch, as it says. But again, nourish yourself throughout the day, however you need to. Breakfast has been served. There's snacks available. Lunch will come out later. So again, it's an open invitation to do what you need to do. Okay. Now, there are some materials at each of your chairs. You may be sitting on it. It may be under your chair. It may be in your lap. Wherever it is, find those things. And if you don't have any in your chair for some reason, there are other chairs, and we can give you those materials. Yeah. Has anyone taken part in like an innovation lab like this, or something under that heading? You have? What was that like? What was it? Okay. The IDEO is an important leader in this sort of these kind of processes or techniques. The idea for them is this idea of human-centered design, which may be a term that you've encountered. Surely you have in your. There's what we're going to be doing today is part of a broad suite of, they're called technologies, called open space technologies. So you may have done world cafes, which are part of that. This marketplace of ideas is based literally on creating a marketplace of ideas. And that is, if we turn ourselves to that canvas, and fantastic for getting an actual canvas, it's literally canvas. We're going to be filling that canvas with ideas. And those ideas are going to drive everything that happens throughout the day. And by everything, I mean the conversations that take place at the stations around you are going to be based on your ideas, your needs, your challenges, small, medium, large, across the range that you see in your organization, that you see across the sector, wherever they lie. So the materials that you have found, the Post-its are going to be the thing that we use to write down the ideas that we then share with each other and go stick in that marketplace of ideas. So we're going to spend, in a little bit, we're going to spend time thinking about what those ideas are, and you can think to yourself, you can converse with others. But we're going to open up some time and space to do that, and then convene here. You don't need to go too far away, but in this area, we'll then come back and we'll have a period of sharing of ideas, so that if you've thought of an idea, a challenge, to then share it with the group here, and then to take that Post-it where you've written your idea down and to go up to this canvas and stick it there. And I wonder, is it possible to move the canvas further forward, or is that okay for everybody? There's risers on either side of the stage, so little steps to then, okay. So if you, so just walk up and stick on the board there. And we want this to, ideally this will happen for a while. We want to get as many ideas on the board as possible. And so through the process of gathering these ideas, what we're drawing out is what's called the collective intelligence of the room. Like I said, everything that what? It's a real thing. And it's the emergent quality of this collective intelligence it never ceases to surprise me. And we're sitting here, it's the blank slate, and maybe some of us are still waking up. I'm definitely still waking up. But what emerges from the collective technology is a whole host of ideas. And within these ideas, we're gonna later find, and some of you will volunteer to do this, that within that big cloud of ideas, there are a number of categories and headings that will then become the substance of our conversations in the small group discussions later on today. So you understand that we need to prime these discussions by creating a rich set of ideas of any dimension, but focused on the challenge that I know that Nancy's talked about in your past communications and with her and interaction with the organization around the issues and challenges that are most pressing in the areas of health and wellness for your communities in San Diego and Imperial counties. And so that's a broad banner under which to fill. So just coming back then to the mechanics of the day. We're gonna fill this marketplace of ideas. After that, I'll ask for volunteers from you to go and work on those ideas as a group. Whether you know each other or not, it doesn't matter. You'll get to know each other and you'll get to work together to build out these categories of ideas. And in doing so, you're shaping those conversations that we're all gonna have later in the day. Now, once we have these categories established, we're gonna take a break. At each point along the way, we're gonna wanna sort of reorient ourselves to the group here in the middle where we meet. We're gonna announce the categories that have emerged. We're gonna talk about the ideas that have come out. And just so that everyone is, I guess, reminds themselves of what's out there, what your interests are, so that when we announce the ideas with the completed marketplace, you'll begin thinking about which discussions you want to participate in later on in the day. Once we have the categories established, volunteers, and that'll be a select number of volunteers, everyone else can take a break. We'll then come back after that break, and we want to basically take on 6 categories at a time. So however we want, you can, I guess, just do what, 1, 2, 3, 4, 5, 6, something like that. And we'll write big numbers on each of these stations, but so stations 1 through 6 will then have categories. And so ideally we're gonna have, I think, 2 rounds of discussion. So a total of 12 categories will emerge from all the ideas. And that the first round, the 1 through 6, you'll then go where you need to go based on your interests, your needs. And each round will last 20 minutes, 25 minutes. We'll see. Yeah, we'll see how the conversations go. There we have flexibility in the day for each round. Now, and we'll do 2 rounds of this. this should probably take us to lunch. But we'll get about that far. Following lunch, we're going to want to come back here as a group and debrief on all that content, all that conversation that you've had. And it's going to be a lot. Now, in each group that we've got, we'll have a volunteer from those who gather to be the moderator of that discussion. So again, that's you. Each booth has a set of, each station has a set of guiding questions to help the facilitator. It'll be on a sheet that looks like this. So these sheets are at each station. And those are questions to, again, guide you in the discussion. All the ideas that we take from the marketplace will be pinned at, we'll then carry to each discussion. So that if you're talking about if the category is homelessness, and there are a collection of ideas that relate to homelessness that have been gathered, all those small, medium, large size ideas under that heading will be at that station for you. The moderator will then use those ideas to guide the discussion. And again, these are just prompting questions that can give some structure to it. After lunch, coming back. What the role of the moderator, and I believe we'll have note takers at each station, is to chronicle, is to document those discussions that happen. After lunch, the moderator will come back here, and the moderators of each discussion, so we will have had 12 total discussions if we do 2 rounds, will then have a sheet of notes that they will have been taking while moderating, and will then present back to the group what exactly the conversation was that took place. And if those who participated in the conversation want to fill in information, the floor is open to doing that. So each moderator will present that conversation that took place. Now, as Nancy said when she framed this event just a moment ago, and if you then look at your materials again, you'll see you've got some colored dots, some stickers. We're gonna ask you to vote on which of these discussions do you think is most important, most compelling, most for the competition, the innovation initiative to look at, or for you to work on in a later stage of development. And so we'll take all of those, the flip chart sheets that the moderators have introduced. We'll put them against both back walls, or just the one? These two over here. And then you'll have a chance to do some shopping. We'll just do a walkthrough of all of those sheets, and for you to look at the notes that folks have taken, and then with your stickies, to vote with, I believe, the green. There's 1 green and 3 orangish, reddish colors. To then vote on top 3. And you can put your dots anywhere you want. They don't need to be, if you want to put them all on one, you can do that. If you want to spread the love, you can do that too. So I've given you a lot just now, and I want to open it up to you for any questions about parts of this process that I've described to fill in or clarify. Any questions? Yes?
How fleshed out are these ideas?
They can be at any stage. They can be the germ, the whisper of an idea to something that you've been working on for years or decades. So again, ideas, challenges of all shapes and sizes. We want to fill and clutter this marketplace with ideas that are relevant to you and your organizations. Thanks for the question. Other points of clarification or questions about what we want to do? Yep.
The dots, are there different values for the green and blue?
Yeah. So the green, that's the first place dot. And the others are the other place. So in terms of the weighting, how did we want to do? We're gonna basically the first place dots just indicate we'll see in terms of sheer number which ideas gain the most votes, and we can use it as a tiebreaker, which gets the most first place votes, something like that. Thanks for the question. Others? Is there anything I'm forgetting? Before we dive in, yep. Yeah, so the ideas can be parts of problems, parts of solutions, parts of processes, things that you've noticed in the organization. It can be all of the problem you see in front of you in terms of, homelessness in the Encanto neighborhood, or more HIV awareness in San Diego County, big. Or it can be small in terms of, about details about funding opportunities for a neighborhood, or for early childhood development, or it can be, really at any stage. So if you're looking at certain neighborhoods or sectors or the county, or if there's funding issues or how to staff or whatever the entry point is, those are the ideas we want to draw out. So, and again, no bad ideas. Like, everything goes on the board. Any other questions about that? Does it seem intimidating? No. Good. So, this is basically where I turn the day over to you, and I'm going to step way back and to moderate when necessary. But I want to give you now the opportunity to, again, think about the ideas and challenges in health and wellness in our counties that are most important, burning, pressing for you, and to write those down. And you can talk. Yeah, it doesn't need to be quiet. Yes?
So how do you whittle down or put ideas in buckets to get to the 6 groups? And how much time do we have in the group, and can we move and go to different groups?
Yeah, good question. So before we get going on this, let me clarify that process. So right now we're at the go big, go broad with the ideas. So all ideas will go to that marketplace. When it feels like we've extinguished the flow of ideas, the last idea has drip dropped from the faucet. I hope that takes a little while. We'll then come back here if you've scattered a little bit, and I'll ask for volunteers. We'll then take a break, but before that, I want to ask for volunteers from you to then go up and take on the hairy challenge of looking at the board with all those ideas on it and attempting to make sense of it. And so you're going to be furiously reading people's handwriting, and you might want clarification, and you'll start moving stuff around. So you'll move those Post-its around and the categories that emerge. So if homelessness is a category, you'll say, oh, from this neighborhood, and there's a funding thing, and this organization, and boom, boom, and you'll want to move them around. And so what looked like a big kind of chaotic cloud will then you'll put in columns or however you want to organize it. And after a period of time, 15 minutes or so, you're going to have a first draft of categories, and that we can then go to those categories and look as a group and say, yeah, this makes sense. These Post-its under this heading would be the source of discussion. Now, in terms of each heading that emerges from that will then correspond to a booth around the room. So we'll just put, ideally there's 12 or more categories that emerge. We'll just number those, And then without any particular weighting, whatever 1 through 6 are will be 1, 2, 3, 4, 5, 6. And then the next part will be for you all to go to the station that interests you most. And so within this the open space technology, there's the idea of the law of 2 feet. Who's heard of the law of 2 feet? The law of 2 feet is you take your 2 feet and you go where you need to go. And so whichever conversation is most relevant for you at the beginning, that's where you go. And if you want to take part in another conversation, if your ear is somewhere else, or you are just drawn to another conversation in the room, then you go there. There will be people in every conversation, but the rule of 2 feet that says that you can go where you need to go. And again, we'll put a time. We'll do a test probably in the first round to see, and we'll start with 20 minutes. And if we need 25 minutes or 30, that's fine too. It really is based on the need of you in terms of the discussion. But I think 20 minutes per round will be sort of the opening offer, but we can be flexible on that. Does that clarify a little bit? Any other questions? Yeah, yes, please. Yeah, so just furiously, tear off Post-its, and then when you've got, a Post-it, so just keep that, if you're writing down one idea, keep that Post-it on your leg or keep it to yourself, because we want to, when you've got an idea, we want you to pop up right here and to share that idea with us, and then when you share it aloud, to then walk it to the board and to stick it on the board. So don't everyone just write down a bunch of ideas, keep them to yourself, and then mad rush silently to the board. So let me give you the time now to think about your idea or ideas, to collect them in your little area. They can be either, yeah. It's under the, yeah, I mean, we're asking the question, what are the problems, challenges, opportunities in these sectors, in the counties? And we want entry points into all of these. So, away you go. I want to give like 5 minutes just now, like whether it's quiet time or you're talking amongst yourself, just for the first round of ideas. What typically happens, we'll start sharing and people will get new ideas based on what's shared, and then you can keep writing. So it'll be like that. So I'll come back in 4 minutes and 43 seconds. We'll be back on. I can model it, but I think you should ask the room. Look at that. Models emerge. You want us to diagram it? I'll give you an org chart and a schematic coming up. So let's dive in. We need a model. Who's the first person? When you stand up, if you want to say your name, you can. If not, you don't have to. But pop up, present your idea, problem, and then walk it to the board. And be loud. You know, no quiet voices when saying what you've got written down. But before you go to the board, you need to tell us what you're going to post. Oh, great.
That includes the physical, mental, and behavioral, social, intellectual, financial, occupational, vocational, intellectual, and all the aspects of wellness. Thank you.
I actually have three. So I'm Gunnar Trommer. I'm a principal for digital health at Boston Consulting Group Digital Ventures. And we actually have put together a social impact committee, which I'm representing today. And we had a brainstorming last week where we identified topics where we want to kind of put our brain trust at work to, and then the three topics are, it's always about applying digital technology, which is what we do as a company. And one is to enhance engagement or adherence for elders, vets, and kids. The other one is to improve access. And the third one is to improve health education. Anyone?
So I just kind of did like big goals we should work on in our county. The first one is that there's no new HIV infections in our county. Pilot trauma-informed primary care. Make sure there's health insurance coverage for undocumented immigrants, and elect more progressive supervisors to our Board of Supervisors.
Woo, I don't know if I can follow that. Okay, mine are all actually very much related to access and coordination of care. I'm just going to say it this way, it's a problem. Proactive and successful care transitions are simply not happening. Lots of technology, lots of dashboards, but it's not happening. Too many veterans leave service without support and health care. I don't understand that. There's a process. Why haven't we fixed it? Access to care, there are no metrics. You can't measure something. You can't figure, if you don't collect it and measure it, you don't know what's happening. So there's no oversight. And the fact is this hurts health and health outcomes.
Sorry, I can pass it along. You go first. You were waiting longer than I was.
Don't worry. Thank you very much. My name is Paul. I'm an oncologist, obstetrician, and psychologist. And I'm most interested in epigenetics. Epigenetics, we're finding out that children are born with racism, prejudice. We take on our historic past, which clouds our present. And I think there's a profound need for perinatology and neonatology family therapy.
Good morning, everyone. My name is Rebecca. I'm with Now Sisters. We work primarily with refugees and immigrants. So my issues are surrounding that. Reading straight off the notes here, healthcare, career training, and placement for refugee and immigrant populations and using technology to train similar populations in home countries, i.e. Africa, Southeast Asia, and Mexico. Breaking down language barriers in healthcare settings and skill building for underserved populations. Amber.
Hi, I'm Amber Cipher-Stevens. I'm with the San Diego LGBT Community Center, and our goal that we are currently working on is to end new cases of HIV within 10 years, starting in San Diego County, clearly, because that's where we are, while creating a transferable model for effective chronic condition management.
Thank you. My name is Alessandra. Besides influencing policies and electing more progressives, so I echo her. I'd like to support and be involved in a study to demonstrate how we can lower healthcare costs by providing integrative and complementary modalities, especially in cancer care, which is not included in the current conventional care, and demonstrate that prehabilitation, so prevention, not just screening, but real prevention, and post-care are absolutely vital for our cancer community. Thank you.
Good morning. My name is Ahmed Sahid, and I'm with Somali Family Service of San Diego. There is millions of residents in San Diego County that have lack of access to quality health care due to language barrier. So language access to quality health care is my topic.
My name is Brenda, and I would like for us to find a way to provide homes for the homeless with no strings.
Hi, I'm Stephanie Furtona at Family Health Centers of San Diego, and a problem is better transitions to healthcare and social services for our justice-involved populations.
Hi, I'm Amanda Quayle. I'm with the San Diego LGBT Community Center, and our primary issues would be keeping patients that are in HIV care, getting regularly tested for their viral loads every 3 months, and how they can be reminded of that, because that takes a huge toll on their long-term health care. High rates of bullying and suicide of LGBT youth in the school districts and the school systems, including with the educators that are supposed to be there to protect them, and high rates of people not knowing their HIV status in San Diego.
Good morning. I'm Sherilyn Jackson. I am the program strategist consultant for the Multicultural Health Foundation, which is the program that under offices of the Patient Health Improvement Initiative. I want to engage today on a one-stop shop for clinical and social services.
Hi, I'm Sarah. I run the food bank in Imperial County. Two major issues. One is leadership, especially in the nonprofit sector. It's very hard for us to keep good leaders in nonprofit Imperial County, and to develop mid-management level nonprofit leaders. But the other issue is that good food equals good health. And we need to move the policy dial on getting health coverage to cover good food education. Who's next? Anybody?
Hi, I'm Barbara Alberts with Feeding America San Diego. And some of the problems that we've seen that we're working innovatively on are addressing chronic illness rates, very high among people who are food insecure. The exorbitant food waste in San Diego. We need to do a better job of connecting that food to those in need. And also addressing the poor academic performance, the cognitive underdevelopment of children who are struggling with hunger.
Thank you. Hi, my name is Caitlin Elliott. I'm with Father Joe's Villages, and I'm interested in building more comprehensive support systems for homeless, unaccompanied youth in our county.
Good morning. My name is Simin Khedivi. I work with Alliance Health Clinic,
And after watching the movie Lone Survivor, I became interested in providing social and health services to soldiers who are coming back from Iraq and Afghanistan to help them build up their lives and dealing with PTSD, physical disabilities, and so on. Thank you.
Hello, my name is Kara Scrounds. I'm with 2-in-1 San Diego. A couple things. So moving from disease management to prevention, I think that includes funding and information awareness, all of those kind of pieces we're still working on. Access to care, it's not just about accessing health insurance, but all the other components of that, as well as lack of senior care and services and access. A lot of the transition in vulnerable populations needs to be addressed as well. I know you were waiting. I'll start it out afterwards.
Hi, I'm Shannon Hansen from Christie's Place, and a lot of mine have been said because all of mine were HIV focused, but the one that hasn't been said yet is that I would like to see routinized or routine HIV testing in all medical settings in San Diego, so ERs, clinics, hospitals.
I'm Kristen Garrett with Community Health Improvement Partners, F4. Availability of fresh, affordable food in all neighborhoods and creating traditional partnerships. Also improving neighborhoods by investing and empowering residents to create the change, so the Resident Leadership Academy model, expanding it. Working on building the capacity of our mental health system, and also health literacy from both the patient and the provider perspective.
I'm Diana with the Corinne organization. We work with refugees from Burma. So I'm interested in the need for skilled translators that are able to explain diagnoses and treatment plans to refugees who aren't really familiar with Western medicine. Also trauma-informed care, educating healthcare providers of the signs and effects of trauma, especially in refugee populations that are experiencing a lot of that. And I'm also interested in the idea of creating warm spaces for the treatment of acute mental health situations rather than hospital setting treatment.
Hello, I'm Ian Morton with the San Diego Human Dignity Foundation and HIV Funding Collaborative. My three topics I'm going to put up there, I'm hoping are applicable to most of what we do here. So two that kind of work together is establish truly neutral spaces for information sharing and moving away from siloed services. And lastly, one thing that's very close to my heart is reaching youth more quickly and effectively with our messaging.
I'm Scott with Mental Health Systems. Treating the costly co-occurring chronic health conditions. Despite Housing First, we cannot house our way out of the homeless situation. Really facing that. Immediately linking homeless in the ER setting to services, and then treating mental health in medical homes versus ERs and jails, putting that into practice somehow.
Good morning. My name is Estela de los Rios, working in the socioeconomic areas. I have several of them. First, poor housing conditions. We are faced with that, and unless our children live in safe and healthy housing, they have health issues. I'd like to see more funding for shelters. We have a very large shortage of that. And because of our diverse communities, I'd like more cultural sensitivity trainings. We have a large refugee and immigrant population now in San Diego. And also trauma-informed systems. Our youth, we need more programs to address trauma-informed systems with our youth. Thank you.
I like the wheel idea. I think that's a good one. So I have a very crowded mind, but I'm going to boil it down to four. The first is care teams have blind spots. They don't know what they don't know. And a solution to that could be a community care plan where a client's needs are listed and then organizations can say, count me in, I can help with that. Another organization could say, I'm already helping with that. The other macro issue is we are organization-centric versus client-focused in our funding and in our programs. And that relates very much to the funding cycles that we go through. And so One possible solution for that is a mezzanine funding fund that would not focus just on innovation, not focus just on sustaining, but a mezzanine round that sort of gets people from the idea through the growth phase. And a way to address the organization focus is to focus on collective impact collaboratives as opposed to individual organizations getting funding. So the collective impact groups could then decide how to allocate the funding across organizations.
My name is Saeed Abil. I'm from Somali Bantu Association of America. My big challenge is improving system responsibility to refugees, all about the health, listening and learning, which is creating DVDs and CDs teaching how to prevent germs about the youngs and the other East African refugees. So that is the situation that where people can be having healthy and hygienic.
My name's Christina and I'm with Shakti Rising, and I have several thoughts, but I'm going to try to boil it down a little bit to say that what I've seen to be really effective and what I feel is needed more of is leadership development, both at the individual and at agency levels, that is really core to helping people understand how they can be advocates for themselves and their own health and for the people that are around them. It's integral in making lifestyle or behavioral change, and that's long-term and sustainable. And it also helps equip our communities to create systems change, because it actually really is up to us to do that. And I see it as an opportunity for us to work less siloed and for us to work more cross-sector, because what we truly need is for us to be unreasonable in what we see as possible and what we know ourselves as individuals can have access to and our communities can as well. And so if we can, again, the problems we see in our time and that we face are many. And what we need are the tools is to navigate those on a daily basis, to navigate the unknown in that way. And so, thank you.
Hi, my name is Cody Johansson, and I work with San Diego Health Connect. I have two issues, and they both have to do with information sharing, because that's what we do, is information sharing. So first one is competition among healthcare organizations impeding information sharing. And the second is confidentiality, privacy, and security concerns around information sharing.
Hi, my name is Laura Berumen. I'm the program director for the Rural Health Disparities Program with California Rural Legal Assistance. And what I'm really looking at is a lot of the same issues that you're all bringing up, but kind of the intersectionality of the ruralness and rural health disparities and how they interact. So I have a lot of things that have already been addressed, but I would look at them through the lens of rural issues, lack of specialists, poverty, and poor environmental issues. So I would say language access in hospitals, LGBTQ youth, and not only their own health outcomes, but when you're already in a rural area and how it's rural LGBT youth health outcomes, unhealthy housing for low-income families and how that affects young people, and unfortunately poorly trained or poorly resourced social services workers that don't understand new Medi-Cal laws and the way that that adversely affects families that don't know how to advocate for themselves.
We may need to talk, you and I, later. Okay, I'm Eileen. I'm with the Foundation for the Children of the Californias and the Hospital Infantil de las Californias. We would like to provide remote medical facilities in underserved areas with our medical specialties via telehealth and telemedicine. So that's, I think, a direction that we will all be looking at in the future, and we'd like to be out there in the forefront and getting it going. The other thing is, I think nonprofits are hesitant to collaborate with one another, and I'd like to see a little bit more of that too. So one of the reasons I'm here.
Totally agree with that. What I would like to see, I'm Diana. I'm with the Cancer Resource Center of the Desert in El Centro. And what I would like to see is an increase in access to preventive care to farm workers, both in Imperial County as well as San Diego County. And I would like to see us work together to make that happen. My other one was working collaboratively with agencies of like mind and like mission in both counties. We could do a whole lot more because our clients are accessing care in San Diego County. We need to work together to do better on their behalf. And of course, to expand comprehensive services for cancer patients in Imperial County, we need more oncological specialists in our community. Who's next?
Hi again, my name is Brenda Balmer with Nonprofit Prosperity Consulting, and I would like to see the health community begin to address climate and environment as a prerequisite to health.
Thank you. I'm Lisa Turner from Palomar Family Counseling, and I identified just two of many issues. One is the need for universal screening and treatment for mood disorders for new parents. And the second is a shortage of qualified child and adolescent psychiatrists in North County, including rural North County.
Hi, my name is Stephanie Norling. I'm with Communities of Excellence 2026. There have been so many wonderful things brought up that I will just add. How do we develop our young people to become leaders, not just in our businesses and our organizations, but in our communities so that they can grow up to address these grand challenges within their own communities?
Good morning, I'm Verna Griffin-Tabor. I'm with Center for Community Solutions, and we work for the prevention and healing of sexual assault and relationship violence. I think I'm just going to summarize all the notes I have into one and say that I really would like to see in all of our public and private schools education about healthy relationships that include a discussion about the underlying issues of oppression that fuel the violence both locally and globally.
Hello, everyone. My name is Jamaica Hartley, and I'm with the Smarty Patch Foundation. And our mission really is to support early childhood education by offering individualized family services and to try to figure out how to fill those gaps that exist when you have the one-size-fits-all for all families, because all families are different, right? So there we go.
Hi, I'm Lorraine McElhern. I'm the Managing Director of the UC San Diego Center for Integrative Medicine. And what I would love to see is true integration and coordination of health systems, nonprofits, communities, employers, and individuals all around this idea of true prevention through diet and lifestyle programs, not just early detection, not just disease management, but true focus on disease reversal. Because I think the chronic disease area is really one where we need to do a better job. Thanks.
Good morning. My name is Alicia De Leon Torres. I work for Survivors of Torture International, and I have 3 things that haven't been mentioned yet. One of them is to increase awareness of and about torture survivors living in San Diego County. There are over 11,000, so 6 degrees of separation of Kevin Bacon. There are less than 6 degrees of separation between you and someone who knows, or maybe you know someone who's a torture survivor. The second and third one kind of freak people out, evaluations. Finding and or creating and using culturally competent evaluation tools at all levels. Because right now we're using a lot of evaluation tools that are coming from homogenous pools of researchers. So let's infuse it with cultural competence. And the last one is good outcome measurements that can be used for arts and cultural activities in use in mental health.
Hi, I'm Shayna Hazen with Jewish Family Service. We're focused on empowering self-sufficiency, supporting aging with dignity, and on community connections. And it's great hearing all of the great ideas that everyone's shared. Some of the things we're interested in are hubs for integrated delivery of cross-sector services that improve health and wellness. Also, the idea of policy advocacy and a policy advocacy network to drive systems change through legislation and also through the budget process at the local, state, and federal level. Also, affordable housing to support the health and wellness of seniors. And lastly, and I think heard a lot of this, how can we collectively measure shared impact as it relates to self-sufficiency and thinking of self-sufficiency more broadly, so physical, emotional, financial, and behavioral health?
Good morning. My name is Clovis Honore. I'm the president of San Diego Black Health Associates. And by way of disclosure, I should also say I'm on the board of directors for the Alliance for African Assistance and the Alliance Health Clinic. And we've used the term underserved. We've used looking at the issues of homelessness. And I wonder if we should look at the question of how does American and global capitalism contribute to all the problems we're here to try to solve? If the underlying paradigm by which we are functioning continues to create these problems, they'll never go away. And we'll always be in rooms like these trying to solve the fallout from a failed system. Corollary to that is a question of how do we use cultural paradigms that differ from the one that we are using, which is a derivative of what we call Western civilizations, which is predicated upon capitalism, which continues to give us the outcomes that we're again in the room striving to ameliorate. Maybe we need to look at African paradigms, or as someone else has said, Asian paradigms, or South American or indigenous paradigms, especially if we're going to look at the question of dealing with true health from a not preventive, but we started off healthy and stay healthy, as opposed to the pathological model that we've been functioning under for the last 50 to 100 years that creates the fallout that we're here in the room to ameliorate.
Good morning. I'm Laura Mustari with Home Start. And it was already mentioned, but I'm just going to underline the whole issue around unaccompanied homeless youth and TAY population. We really need to focus on that group. The definition of homelessness from HUD does not fit young people. They do not look the same. And so let's keep focusing on young homeless youth. It's a prevention model, and keep those conversations going. Of course, they need more funding. And then the second issue is social enterprises. We are new at this. I know some other folks are looking at the model, and it would be great to bring everybody together and it's sort of an incubator, and let's bring some business folks in and help us think through that social enterprise can eventually make money for us. Thank you.
All right. Hi, Alan Johans with the City of San Diego. In the frame of policy, it seems like at the state and local level, there's a lot of conversation about affordable housing, but not much conversation about the existing housing, low-income housing that really needs to have the quality of housing improved to improve health. Working with our senior population to improve the long-term health, using an integrated team of housing specialists, occupational therapists, and nursing to allow them to reduce long-term care costs. And then a sustainable financing strategy using savings to pay for preventive work on chronic diseases such as asthma. Sure.
Buenos días. Good morning. My name is Soledad de la Costa, and I'm with Health Equity and Community Strategies. Thank you very much for having the patience to listen to all of us. And I realized that some of the themes are recurring themes and very well interconnected. So some of the ideas will be repetitive to what you already said. I believe that one of the issues that we're seeing here because of the Affordable Care Act, and all of us somehow are connected to that, is looking into healthcare outcomes that are really linked to the practices that we're having in place, but also the quality of care linked to the community reality that we're seeing, and how we're gonna very much integrate our services and our outcomes into a functional and effective outcomes to our community. And for looking at that big perspective that we are seeing in San Diego and Imperial County and Southern California, along with the border, we need access to reliable data that is looking into the social determinants of health that we can all share and we can all understand the nonprofits, the profits, the service providers, that we can all link and to see the same system and the same perspective without necessarily always looking into seeing what do you see and where do you find out and who give you that data, but something that is common, that we all have access, and then is looking into the same slice of the pie that we want to see. For that, I very much concur in the funding collective health outcomes impact that was already mentioned, to have that space and conversation into who is doing that, how we can promote some networking that is effective linking into the next phase. And of course, with that, we need to link our economic development, like was very eloquently said before, to the county health. We have right now the Living Well San Diego. What does that mean to us? How that measurement is really linked to our organization and what is our role? And we already talk about immigrant health and in the integration of assets, the social cultural assets and the needs for that community. And of course, you know, the coordinated accountability for system response among our population of homeless, and a very different approach and response to mental health issues that we don't have. We talk about, we have an enormous, we hear epigenetics. I wish we will have the same tools and diversity and approaches for mental health. Thank you very much.
Good morning, everyone. My name is Carlos. I'm Medina. I'm here with the San Diego County Medical Society Foundation. And echoing what many people have said, I just briefly wrote down access to healthcare for all residents who are working, involved in their churches or communities, and paying taxes, language barriers, coordination or consolidation of like service providers, and lastly, promoting nonprofits as critical pillars in the community. Thank you.
Hi, my name is Christina Selder. I'm from Consumer Advocates for RCFE Reform. And the topic we bring is the availability of residential care for low-income seniors in San Diego, and most importantly, the quality of care that they receive.
Good morning, I'm Natasha Machette. I'm with the Multicultural Health Foundation, and we work with the sickest, most chronically ill patients in San Diego. And how we do it is that they've been using the emergency room as their primary care physician, and we move them home and do their medical care at home through our patient center, our patient health improvement initiative. We've made great strides with helping these patients move from crisis to chronic management and hopefully to wellness. But what we're finding is that they are regressing back to crisis care. There's a 30% regression. And in talking with them, they've said it's because they don't have access to the social services that they need. And additionally, no one tells them, no one teaches them what to do. They said, and I'm sure many of you had this experience where you go to the doctor and they say, you need to improve your health, you need to eat right, and here's a brochure. And they take that brochure home and they don't have a clue. So our idea is to expand the Euclid Health Center to create a place for them to not only receive the clinical care that they need, but also the social service support, backed up with training right on site through teaching kitchens, wellness gardens, education that will teach them the skills so they can transfer all the information we're telling them about health and wellness and nutrition into real world practice. Thank you.
So this looks like, oh, Don's over there, he's got some names, some ideas too. It looks like the lines are minimal. I want to put out an invitation if anyone has not put an idea on the board to think about an idea that you want to share, and to do that in the next few minutes. Leticia and then Don will speak, and if anyone else, they should jump in line behind them.
Hi, Leticia Cáceres with San Isidro Health Center, and I would have to echo what Liz said. We have to elect more progressive elected officials. But before that, and in order to do that, we need to be more engaged civically. And I think civic engagement is huge in integrating advocacy, effective advocacy models within all of our organizations is key to affecting macro level changes. And also health access is huge, and that's a big theme with that health for all, health coverage for all. We need to change our CMS and open it up to undocumented immigrants. Health literacy, coordinated care, an idea, clinics and hospitals working better and more closely together and sharing information. Accountability of health insurance plans. Our health insurance plans, especially in California, have made a lot of money this last couple of years, and they need to be held more accountable and start giving some funding to community health efforts. And then workforce development. We need to obviously focus on primary care providers, but also having a more representative healthcare workforce. And then finally, translate research data in a way that the community can actually use. We have a lot of research happening here at San Diego State. Let's get that data and have that be able to use at a community level, because right now it's just sitting there.
I'm actually a spokesmodel for several people in the back. So, and related to two of the folks that just came up and talked, the talk about really creating a cultural and linguistically competent workforce in our areas of work and how to create a pipeline of more people there. The second was looking at advocacy and really teaching consumers to be their own advocates in the healthcare system. And then the one I was kind of waiting to see if somebody else would pop up with, we're having a huge problem finding enough providers in behavioral health. So the policy has changed with the Parity and Equity Act, and then there's also healthcare reform, and there are not enough mental health clinicians and substance abuse treatment clinicians within clinics, hospitals, community service organizations, and we need to expand capacity.
Good morning, everyone. My name is Ariel Golden. I'm with Feeding America San Diego. I have two ideas since we work in the food distribution field. One is to incorporate physical activity education into food distribution. So at food pantries and soup kitchens, there's a lot of people standing for hours and hours waiting for food. Not only is it not dignified, but I think there's a lot of things we could do to better use that time. And the other is to incorporate healthy food standards into the food distribution network. So not only on the agency side where agencies distribute healthy food to their clients, but also on the donor side where people who donate food are more educated about what foods really help and what foods don't help bring people to wellness. So thanks.
Are we live again? I think we are. Wow, it's a lot of ideas. So everyone just take, I'm sure you've been watching while this has been unfolding, but have a look at what you've done. And that's good work. That's well over 100 ideas, post-its that you've contributed to a marketplace of ideas. And for the rest of the day, it's about not only making sense of that cluster of incredible inspiration and motivation, urgency. That's the next step. Would be creating our categories for discussion, but then getting into those discussions. So let me orient us to the time, which is about 10:30. If that gives us about roughly 2 hours until our lunch break. But again, I think there's some flexibility there. You know, when is lunch going to be served? Will it be served at 12? Yeah. Yeah, so 12:30 is scheduled lunchtime, but if there are tummies rumbling, I'm sure we can expedite. So over the next couple hours, the first thing we're going to do is, again, I want to ask for volunteers from you all to take a crack at creating some order from that wonderful chaos and jumble of ideas on the board. I also want to orient you to the screen above those ideas, which is the growing Twitter feed under the hashtag AHF innovation. And to add to that, if an idea jumps out, if there's a snippet of conversation, if there's something that didn't make it to a post-it by any chance, tweet it, send it out, and share it with others. So at this point, basically, we'd like to call on some volunteers. Not everyone needs to volunteer, but those who want to volunteer and come up to the stage, look over these post-its and start making some categories for our discussions, I invite you to do that. And for everyone else who, you're welcome to take a break. You're welcome to attend to anything you need to be doing right now. If you want to look on as the volunteers are making those categories, you're welcome to look on as well. I'll be on stage. I think Nancy, possibly Michelle, others will be on stage for any kind of guidance that you'd like or questions about making these categories. So, and just before we do that, I want to ask, are there any questions about anything that comes next once we've made these categories? You can ask questions anytime, but if there aren't, so please, anyone who'd like to volunteer, join me on stage.
Hey, everybody. We would like to get a group shot of everybody and the work that you've done over here. So I want to try to get people back in here and standing here in front. Don't all rush the stage at once. We want some people on the floor, some people on the floor, some people on the stage. Come on back, everybody. Let's get this group shot. Do what? What? Oh, yeah, okay. 2 seconds to put on your lipstick, especially all you guys. Scott. Michelle. Oh, come on, Elizabeth and Jeffrey. How are we doing? Oh, where'd Cece go? Okay, we're gonna have to get some more people in the front, here in the front. We can't be one big long line. So, short people in the very front. If you've ever been called short, Okay, so we're gathering back in the middle. Gather back in the middle. If we could get everybody back to the middle, that would be great. Into the inner circle. I see a lot of people going to the left. Come back to the inner circle. That's cutting it.
All right, everyone, maybe we can gather back into the inner circles here. Are we live again? Hello, hello. Great. So welcome back from break. And we can. I don't know how long this song goes. It feels like it's on a loop to me. Bow to your corner, bow to your partner. Do-si-do if you want. Okay, so what I'd like to do at this point is to have the team of volunteers who was up here on stage just to stand up and have yourselves recognized. The volunteers on stage, stand up. There's more than that. Thanks for your work. And I think Soledad is gonna present the 15 category headings that we came up with. And I'll just, before you introduce them, so we came up with 15, and just in terms of the mechanics, we've got, as I said before, we have 6 stations. We're actually gonna cut one of those off. We're gonna go 5 stations, and we're gonna do 3 rounds of discussion at those 5 stations. So that's one more discussion that you'll be able to take part in. And we'll just move left to right. So whatever 1 through 5 is will be the first topics that are put out to the group. Okay, so let me hand the mic over to Soledad.
Is it on? Well, thank you very much for all the turmoil to come up with this. And the categories that we have so far is health, literacy prevention, immigration, youth, seniors, leadership development, homeless, health access, healthcare access, workforce, food insecurity and healthy food access, combined education, HIV, mental health, system change, collaboration and network, and cultural competency.
Okay, so we're gonna just, we'll take these groups of Post-its and put them around the room. And just as an example, so number 1 is health literacy and prevention. And again, we'll start with 1 over there and work our way around the room. And if I can get some help moving the Post-its.
Oh, except they're too big. They're too tall. Can we have some tall people?
So I just took, for those helping, I just took the category heading and all the Post-its. Sorry. So we need youth and seniors.
Just doing 5. How many here? This is 1. So, yeah, what do you do?
So I think we have our 5. And I'll announce those. I'm going to go mobile here and just walk around the room. So if you're following my voice, Station 1 over here is health literacy and prevention. Health literacy and prevention over here at Station 1. Moving around to Station 2, what do we got? Oh, sorry, 2's back here. I flew right by it. Station 2 is immigration. Station 2, immigration. Station 3 is youth, right here with Carlos, right? And let me jog around. Station 4. What do we got? Station 4 is seniors. Seniors are at Station 4. And 5 is, what do we have? Collaboration. Network and collaboration over at Station 5. So again, who remembers? You know where you're going? Health, prevention, and literacy, immigration, youth, seniors, networking, and collaboration. So this is an invitation to go to the discussion circle that you'd like to start with, keeping in mind the rule of 2 feet. Wherever you need to go, you go there. And when everyone is at a station, I'm going to just remind you again about the role of the moderator. Yep. Okay. So it looks like everyone's pretty close to finding their stations. So I'm over here at Station 3 if you're following my voice. So for each group, we'd like you to, among each other, to someone to self-nominate, or we need a moderator for that discussion, and then someone else to be the note taker, the scribe for the discussion. And for the scribing, there's a yellow legal pad at that station. So if the scribe note taker wants to find that, and if there's a brave moderator who wants to 20 minutes. We're going to do 20 minutes per round. So I also want to remind the facilitators, I mentioned this in the beginning, but we've got a sheet of facilitator questions. This is on a single sheet at your stations. It has a gold back. Also, if you need for reference during these rounds, the same 3 questions are here on the main screen. So in those 3 questions, and let me just talk a little bit before you get to your discussions. What you have in front of you now is a series of Post-its that are your ideas that we've gathered. They're stuck to the whiteboard in front of you. The facilitator has in his or her hand the list of guiding questions. Somehow in your discussions, there's going to be a conversation that takes place between these overarching guiding questions and the ideas that you created and sourced that have been stuck to the board. however the facilitator wants to go about using the ideas that are there. One possibility is that the facilitator can read through the ideas, the individual ideas on Post-its that appear. The overarching questions are really about the individuals at that discussion right now, and those questions are, what brought you to this discussion and what role do you currently play in the area you're talking about? The next is there anything that you need to include under the heading that is your station? That is there something missing that you think in the conversation? So whether you want to share that at the beginning or somewhere throughout the conversation, these are the kind of things that will naturally, I think, emerge. And then I think this is prompting maybe for the moderators of the discussion, but for all to keep in mind. As your discussion moves forward, and we'll give you a 5-minute and then a 1-minute countdown over the 20 minutes you have for the discussion. What are some desired outcomes that you'd like from the conversation around this topic, or other outcomes that you'd like to see from the competition? A discussion of outcomes, I think, is a rewarding part of each of these discussions that take place. So again, your moderator has these guiding questions. They're on the board. The ideas, your ideas, are on your flip chart. Enjoy your discussions. Let the 20 minutes start. So that's 5 minutes left in your discussions. It's been 15 minutes so far. I hope your discussions are going well. We're at 2 minutes right now, so 2 minutes left in your discussions. Some things to work on would be to consolidate your ideas around some possible outcomes. If there are points you haven't gotten to get to those, and to find a way to tie off this conversation and wrap it up for now. Okay, guys, that's time for this round. So why don't finish off those conversations, make those last notes. I came around to each of the groups. I want to remind you for the scribes, the yellow pieces of paper, keep those yellow notes with the flip chart pages now. So scribes and moderators get together and put your pages together. After lunch, oh, right, this speaker's pointed that way. The moderator and scribe, just keep your pages together for now. So everything you've written on the big chart and everything you've written on the legal pad, put those together. After lunch, I'm going to invite all the moderators and all the scribes that work together to finalize their notes and get everything that they want onto flip chart pages. But for now, again, the yellow pages and notes should go with the big white sheets from the flip charts. Just put those together. Because before you do that, now everyone's going to get up and we're going to go move on to a new discussion. So, So they're going to have everyone's attention for the next round of topics, the next round of discussions. In station 1 will be leadership development. Station 2 will be homelessness. Station 3 will be health access. Station 3, right over there. Station 4 will be workforce. Station 4 is over here, stage right. And in station 5 will be food insecurity, healthy food access. So station 5, all things food related. Station 1 is going to be leadership development. Leadership development in station 1. Station 2 is homelessness. Station 2, homelessness. Station 3, health access. Health access in station 3. Station 4 is the workforce. Workforce in station 4. And station 5 is all things food, food security, food access. Wow, that's a lot. Station 1 is leadership development. Station 2 is homelessness. Station 3 is health access. Station 4 is Station 4. Station 4 is workforce. And station 5 is food access, food security. Station 1 is leadership development. Station 2 is homelessness. Station 3 is health access. Station 4 is workforce. And station 5 is food security, food access. 5 is just behind you. Station 1 is leadership development. Station 1 is by the door where you entered. Station 2 is homelessness. Station 3 is health access. Station 4 is workforce. And station 5 is food security, food access. How are we doing?
Grab the first ones and start putting them back here.
Yeah.
Okay. Should we make it bigger?
Yeah. No one is in workforce. Yes. So just for more clarity, after lunch, we're going to come back to the first round of discussions. Right now, I want to ask that for each discussion group, that we have a new moderator. So if you moderated in the first round, hand that pen over. Let's find a new moderator, and we also need a scribe, a note taker for each discussion. So please self-nominate or find within your group a moderator for the discussion.
What are we doing? What's happening?
Leadership development
Yeah.
is station 1. Homeless is station 2. Health access, station 3.
Please.
1, 2, 3, 4.
Of 5 minutes left in your discussions. 5 minutes. Okay, everyone, we have 1 minute left in this round of discussions. 1 minute left. Moderators, please bring your conversations around to some final outcomes, some final points and takeaways. 1 minute left. And that's time for this round. I know those 20 minutes go fast. Try and get those last notes down on the flip chart page. If someone was taking notes on the yellow paper, remember to keep those yellow papers and the flip chart pages together. Try and keep all the Post-its as well from this round. Put all the paper together. Yeah. All right, so we're moving into our third and final round of discussions. I'm going to try and wind these conversations down. We've got to move on to our third round. Yeah. So there's a movement afoot to break for lunch now, which I heartily agree with. So what we're going to do is this. Again, keep those pages from this round together. You can stand up from your stations, take a breather. Lunch will be out as soon as lunch is out, 5 minutes or so. We're not going to do another group round right now, so let's break for lunch. Take a half an hour or so. I'll check back in with you in about a half an hour, 35 minutes, and let you know how the afternoon program is going to go. So, bon appetit, lunchtime. It looks like the lunch is out, so lunch is served. Go get it. Is this on? I just wanted to let everyone know we're going to come back from lunch in about 5 minutes. 5 minutes.
Hello, everybody. I hope that you've had, I can tell you're having great conversations. See you getting some work done. We're about ready to have you come back so that we can do the last round of discussions. Do we want to tell them where they are first already, or you want them back in the inner circle? Okay, so we need everybody to come back into the inner circle so that we can figure out what we're doing next. The problem with me being out in the community so much is I know all of y'all's names. So I can start calling names. Like we're almost there. Get everybody back. Come on, Jan. Come on back. Thank you. For those of y'all that went outside, is it nice out there? Maybe I'll go check it out in a minute. Is it getting hot? It's supposed to be hot, right? Like tomorrow is supposed to be brutal, I think. Right? All right, we've got a few more stragglers over there. I'll turn off and let you take over.
I think I'm back on now. So as folks are just getting some coffee, some tea, feel free to, again, get up as you need. I want to just talk about the afternoon program today as we rounded out our morning and going to finish strong. We've got one more round of discussions that we're going to get to. I realized that lunch was very necessary when it came. So let's come back from lunch to this last round of discussions. I'll announce the subjects now where they are. Station 1 is education. Station 2 over here is HIV. Station 3, just behind you, left side, is mental health. Station 4 is systems change. And Station 5, over here to my right, is cultural competency. So I'll keep announcing those. So what we want to do is this, is to have this next round. We'll do, again, 20 minutes to that. At that point, we will have had 15 total discussions among us. And as you know, from each of the discussions, there have been moderators and scribes getting notes down. And what we've done is those conversations and notes are on the back wall right now. So those are the first 10. And from these last 5, we'll put those 5 collections of sheets also on the back wall. When we get those last 5 sheets up there, I want to then invite the moderators and scribes from each discussion to go find your discussion sheets, to look over them, and to then come up with a 2-minute or so presentation, just to, again, share back with the group what was discussed in what was probably a diverse and passionate discussion that you had. But to take 2 minutes to describe what you wrote on those flip chart sheets, and again, to address some of those big questions that are no longer on the board, but the moderator led the discussion around. Once the moderator and/or scribes share from each of these 15 discussions, I'm going to invite everyone then to get up and to then go walk through the gallery of flip charts and discussion notes. And that's the time when I'll direct you to find your dots, your green and orange dots. And as you are looking over the notes from the discussions, to start voting on which set of ideas, which topic really resonates with you, based on a discussion that you were part of, based on a presentation that you hear that you think merits real further investigation. They all do, but we'll see what rises to the top for today. And then following that, we're going to come back here and we'll know what the top vote getters are. But I want us to close, and Nancy will, and I think Elizabeth will probably share some closing words as well. But I want us to also take time before we leave today to do a period of reflection and takeaway based on anything that you heard, saw, or were part of during the day. So that's a brief sketch of our afternoon program. We'll try to wrap by 3. That's still the plan. So it gives us just under 2 hours still. But so our next step is to go back to our last round of discussions. And again, so you can get up if you want. Station 1 is education. Station 2 is HIV. Station 3 here is mental health. Station 4 on my right, systems change. And system 5 is cultural competency. So please find your discussion station. We have education at station 1. HIV is station 2. Mental health, station 3. Systems change, station 4. And cultural competency at station 5. And again, when you get there, if someone could, if you haven't yet served as a moderator and would like to, this is our last round, so a new group of moderators would be great. There's a yellow legal pad for note-taking as well. The moderator should, while moderating, collect as many of the ideas on the flip chart sheet as possible. 2 minutes left in these discussions. 2 minutes left. So that's time for this round. Start winding down your discussions. Those final outcomes, notes on your flip charts. Please remember to keep the Post-its together, the white flip chart sheets together, the legal pads, the yellow notes, all the papers together, please. If your discussion group is over, please come back to the center circles. Yeah, make your way back to the center circles. In preparation for the last part of the day. Yeah. I know some folks maybe need to leave early, and so they want to present their sheets. We're generally going to work from left to right on this wall, and I'll have the moderator, and if there was a scribe, the scribe can go as well. But I'd like the moderators of each of these discussions to present in 2 minutes or less, preferably less. The moderator for each of these discussions will come center stage and give us a 2-minute maximum share out of what the discussion was about. I know there was a lot of pieces to the discussion. It ran in many directions, but try and tell us what you've written down in those notes. We're going to go through and present these discussions, and then the last piece of the day will be, and Nancy will tell you more about it, the voting process. So, Jana, you've got to go. So let's start with education.
Do I have to? I can't see that far. Go over to education. Okay, thanks. I can't. I'm not going to education. I'm going to health access.
Oh, you did health access too?
I did. Don't even want to go with me. They told. Okay.
First up is health.
Okay. Here. Is this on? Good. You can hear me. Obviously, access to healthcare, access to health access, whatever, could get pretty broad. So we took it down to a number of areas and then tried to roll them up. Our roll up includes accountability of those organizations, agencies, providers, health plans, government that are already required to meet the regulatory requirements, meaning some of the stuff we want, it's already on the books, it's just not being enforced. And so we're saying that's for access, for language, cultural competency, for actually providing coverage and access to care to people. And we talked about some ways to do that. And that would be, one is measurement, another is oversight, and the third one we all talked about was policy advocacy. So that's one big wrap up of a pretty big issue. I think you'll all agree that's pretty big. The second item was coordinated integrated health and social services, and this very much includes health information technology in that solution that is person-centered and accessible. That means location. We don't always have to bring the patient to Mecca. Maybe Mecca can go to the patient or closer to the patient. The third item was funds to support preventive alternatives. And this is really cost avoidance for high-cost services. Right now, you could do those preventive services, but the people who benefit, the ones that are paying for it, aren't necessarily funding that. And so looking at a way to sort of maybe reverse that and return some of those savings, that cost avoidance, so that we can implement more of those activities that would actually reduce high costs. Why do people go to ERs? Why do people end up in accidents? So I hope I captured it. We have a whole list of other items there, but those are our top 3. Anybody from my group wants that?
So immigration, we came up with that we'd like to include refugees and asylum seekers because we all agreed that it was the same challenges but just a different status, and they all have to be included regardless. We talked about Imperial County has communities that are affected by the border, just like San Diego. Example, farm workers. We have to include them as well. Refugees have an array of issues regarding cultural language barriers. Immigrants also are torn by separation of families. And it's difficult for them to come out and seek health coverage because of the political climate surrounding, for example, North County was up here. Some of the added items were fear of a new country, fear of new laws. This applies to refugees, immigrants as well. It also says that culture sensitivity training should be available, for example, religious beliefs due to beliefs about blood transfusion, for example. Some cultures don't allow that, so then it affects the health of that family. Language is a barrier, transportation and childcare is a barrier as well, and the policy needs to change. So our solutions, if many of you know, there's a LARA bill, which is a state bill that has, if it passes, it's health access to all, regardless of your status. Hopefully that outcome will come into fruition. Provide health competency training to health providers to address all these barriers that embraces all immigrant communities. Language translation is key because we have a diverse language issue. Like, for example, in City Heights, there's like 80 dialects alone. Seeking professional health providers who speak the language and are bicultural. So these are some of the solutions and some of the issues that came up. I think I covered most of them. Also, trauma-related experiences. All these countries come with some trauma, and we need to understand some of that. Thank you.
We were a mighty group of 4 people. I think we were the biggest one there. So the key thing that we talked about with workforce was that we saw it as sort of bottom of the pyramid, that we felt like for people to do well in life, they needed to have a job and have income and have economic viability. So that was what this sort of summarizes there. Our 3 key outcomes that we talked about. The first one was a 3-pronged strategy to dealing with increasing diversity in the workforce. So we talked a little bit about folks wanted to see people in the workforce that represent those that they're served. We also talked about training workforce, work environments around cultural needs and specifics. And then the third was access to more certified interpreters or cultural liaisons. And then also with workforce, we talked a lot about building workforce pathways and pipelines to address specific gaps. And we talked a lot about the need to increase cultural diversity in that environment. And then the third was we talked about a job network or a job bank, and we were looking at some ideas around data and tech solutions that might build some of that networking or that bank. And we know there are already some existing platforms, but can we create a more robust platform? And then we talked about workforce readiness and assessment, and how a lot of that can be done online, but how do we make that accessible to all?
Hello. Our group did cultural competency, and one of the first outcomes we came upon was the integration of the population being served in the management and the board. We know a lot of promotoras and community outreach workers are very common, but actually getting up into the management and the board is not so common. So having the integration is really important. Our second outcome was cultural competency training using, Clovis, you might have to help me on this word. It's like, Clovis made it up. History. Oh, okay, darn it. All right. Historicity, which is basically using the context, like, for example, here in San Diego, we work with a lot of Burmese cultures and Somali cultures, making sure that people are culturally competent in the context of what's going on in the community that we're serving, and we don't really see that too often, as well as using emerging leaders to influence outcomes in policy. That we have a lot of people in the room that are younger that can really make differences around cultural competency, and we need to utilize that.
Want to go back to the beginning? Okay, so now we can go back to the beginning and start with health literacy. Who was the monitor here? Who was the facilitator for health literacy?
Wasn't sure it was going to be me or Ian, the wonderful scribe. So, so I'll try to do a good job for both of us. So we first looked. Our area was prevention and health literacy, and at first we felt that these were quite actually different areas. So we thought we wanted to define each one first. Prevention. Actually, let me start with because prevention is kind of before you kind of have the disease. Health literacy could actually be about not just health, but actually the disease or insurance literacy. So they had kind of different meanings, and we broke them out, and we ended up coming to actually a common denominator of things in the end. One was that we felt that whatever awareness needs to happen, and there is a lot that needs to happen, it really needs to be at the community level, the systems level, and the policy level. I saw actually a huge connection between what we talked about here and actually the next two groups that I was in, which was the systems change and the leadership. So I apologize if I'm stealing any thunder from any of the others, but I felt like what we really came to in the end here is this idea of complete cultural and societal change that really needs to happen for true prevention and true health literacy to be a reality, and collaboration is the key. So this is something we would love to, these are kind of the main areas we would love to explore further and figure out how to replicate positive changes throughout every one of these levels that we've talked about that is really important. And then at the individual level, really owning that change and empowering the folks that are at every level. Okay, I think that's it.
All right, so we have youth.
All right, now it's been a while since we actually had done this, so allow me to refresh my memory while I'm speaking to you. But for youth, primary focus was mental health, and that is a very broad category that includes bullying, untreated trauma, issues with stigma, and family dysfunction, cycles of abuse, and how that can affect youth. Another main category for us, I believe, is homelessness. That was one that we felt was important to address specifically for youth, expanding the definitions of homelessness to be more inclusive to youth, ensuring that outreach initiatives are targeting the young, and applying best practices that have worked with other populations toward youth populations. And last but not least, I'm just trying to make sense of all these words. Passion. Passion's important.
Thank you. Seniors.
All right, we were a small group, but we had a whole lot of discussion. Our three top outcomes were integration of all aspects of aging, culture change, and an actual integrated network of caregiving and community. And what goes into, there's a lot that's wrapped into all of these things. First of all, It varies from community to community, but culturally we have this tendency to pretend we're not going to age and we're not going to die, which means that we separate that whole part of our life from the rest of it, which has a lot of impacts in a lot of different areas. We also talked a lot about how people are members of a lot of different communities. So your senior may be part of a senior community. We hope they're part of some community. They may be part of a church community. They may be part of a cultural community. They may be part of a social community. And as we're dealing with this increasing swell of seniors, we really need to find a way to connect all of those communities together because they all serve very different purposes. Then you have the caregiving community, you have the family who may be providing care. All of it needs to be sort of stitched together in a way that provides support not just for the seniors, but also for instance, their families, their caregivers, those who are around them and bearing part of this burden. I could go on and on and on about all of this. As I said, there's a lot that goes into it. But I think that probably gives you just a nutshell version of it.
Come on. Did everybody hear that? I've heard that in the community a couple of times now, that the term silver tsunami is not a positive, and so we'd like to try to make the effort to eliminate that terminology in reference to seniors because we want to see aging as a part of all of life, right? And that's a positive. Thank you. Thank you. Collaboration.
I know. Well, collaboration has a very challenging issue because as you are hearing all the themes is through collaboration. So we have, a paradigm shift between funders, organizations, and the community that we serve to relearn new ways to collaborate and then to have issues addressed and then like townhouse meetings ready to use for every issue with experts, networking, and everything else in a sustainable way so we can step into the plate and to respond into the community in an accountable manner. And we talk a lot about the shifts that are needed, but pretty much if we have an issue, we have the adequate data and metrics to do that and support in a very sustainable way to have a collective impact approach into what we're working with. That will be our framework for collaboration. Thank you.
Thank you so much. Leadership development.
Yeah, so leadership development, we talked about a lot of different things, but the biggest points that kind of stuck out were first that there needs to be a little better training around relationship development, which then leads to leadership development because a good leader develops relationships. And actually this top document up here, or slide or sheet basically talks about how there's 5 different levels of leadership. The highest level is expert, the second highest is friendship, then authority, then money, and then coercion. And friendship is the only one that's actually enduring. So that's, relationship building really is what the important part is. And then other parts that are important to leadership development is understanding how it's okay that 2 sides might disagree on how to do something, but they still work together and come to a joint resolution. And then we talked about diversity in leadership as well, where a lot of culturally leadership is more kind of male in the way that it works, but a lot of people in this community and whatnot, it might be female. And so it just changing diversity in leadership and just changing the way that people think about leadership in general. So, yep.
Thank you. Thank you.
Homelessness.
All right. So with homelessness, there are so many different populations that fall into that category. So we really had a challenging time identifying a few key points that we could share. So we talked about the role of resources and how there needs to be an increase of resources available throughout the county. Especially, we talked about how a lot of resources are concentrated in the downtown East Village area, and that the need is really county-wide, so working to address that. We talked about the LGBTQ community and how they might not feel, or people who identify that way might not feel safe enough in certain spaces that are meant to help people with housing insecurity. So working toward something to help with that. Children and families, very important, making safer spaces for children and families. And our 3 desired objectives and outcomes. Number 1 was really prevention. So taking a look at how that could be addressed in primary, secondary, and tertiary ways. Thank you to the doctor who suggested that terminology. And then more agency collaboration. I think we do see that, but maybe get more creative with how we collaborate and who we look to be our partners in addressing homelessness. And then focus more resources and support on transitional or acute homeless populations. So yeah, in a nutshell, we tried. Thank you so much, Caitlin.
All right, we are going to food. Who did food?
When we talk about food, we talk about food systems and how a radical shift needs to happen within the medical care system, in which we envision that the medical personnel, health professionals, are actually prescribing and educating the community, but not only to have access, and being that the community have access and affordability to that prescription, but also the knowledge and the true integration about the farm to table and the education system and everything else. We also talk about the education related to food pantries and food access, not only for the people getting the food, but also accessing the donors. And so they have a very good pool about what to donate to those services. And for the decentralization of services, in which local food is serving local communities. And we also talk about some need for policy changes that is not only for the SNAP program, but in general, to really make a difference into the gaps for the community insecurity, and addressing the overall issues in food systems that is impacting not only the food by itself, but all the people that work in the food industry, grocery stores, and so on and so forth. So some of the economics can be shifted to address for long term.
HIV.
Thank you. Alrighty, for HIV, I think first of all, everyone in our group pretty much agreed on the goal, which is no new infections within a certain period of time. And that's kind of the national tagline right now, is we're trying to get to 0 new infections. So we kind of broke that down into 2 different categories. First of all was HIV care for individuals who are HIV positive, and then HIV prevention services for individuals, especially high-risk individuals for infection, and kind of figuring out in the middle, where does that all meet? And one of the other pieces that is really important to talk about is the high rates of individuals who don't know their HIV status. For those of you who may or may not know, it's been suggested by several studies that about 50% of new infections are transmitted by the 20% of individuals who don't know their status. So we really kind of talked about things like the fallout of HIV stigma overall, how that affects people's ability to get the courage up to get tested, to know their status. Once they are diagnosed, following up with care and getting into care, and whether they're in a space where they can actually get the sort of support that they need to maintain their care. Because especially when we look at HIV care for positives, the more individuals whose viral load we can suppress, the less likely they are to transmit HIV to someone else. So our three big takeaways, putting all of this together, was, first of all, we want to normalize the conversation across the board. That means with providers, that means with individuals who are at risk, that means letting people know who is at risk, and being ready to have those conversations and creating a landscape where people are comfortable enough to have those conversations. We really see the benefit of having a comprehensive needs assessment of the benefits of testing and early detection. How much money can we save by, first of all, getting someone into treatment immediately, making sure that they are getting tested and not transmitting new infections, and all of the care that comes along with being diagnosed after you've already progressed into AIDS. And last, but certainly not least, is the collaboration and information exchange to facilitate systemic changes. We really want to see the community groups, the clinics, the larger health systems all talking with each other, finding ways to have conversations to really make, again, create an environment where we can end new infections.
Do we do education? We did education, yes. Mental health. Love you too, Jan.
Okay, we had a lot of discussion around this because I think the overarching theme we realize is that every one of the issues that's on this board impacts a person's mental health. So it's such a global topic to discuss because if I don't have enough food, there's a lot of stress, which affects my mental health. If I don't have housing, it affects my mental health. If I have a chronic health condition, it affects my mental health. So this is our job at sort of reducing this down to just this topic area and knowing how broad it really is, knowing that there's not enough resources and there is a huge cost to untreated mental health issues, from days off work and sick days and inability to even get treatment for your issues or accessing any type of mental health care, integrating primary care and mental health. Right now we have a sick care model, and how can we work more with prevention and early intervention, as well as how can we increase education about how to maintain and strengthen your mental health. So there's a lot of different issues here around compassionate care, robust wraparound care, but our five main issues were access to treatment, systems change, whole person, so that we reduce the stigma. So we're not just talking about my depression, but we're talking about my health, my overall wellness, and looking at all the different ways that can be impacted by stressors in my life. We talked about the tobacco campaign and how over time, how effective that has been at reducing cases of smoking. So how could we incorporate something like that, an ad campaign about mental health? There's something going on in San Diego right now that's really a great model, but making a nationwide model to destigmatize mental health issues. Again, alternative, complementary, holistic care, prevention, looking again at preventing mental health issues, and then just in general, increasing mental health providers that are out there. It's very expensive to become a mental health provider. So how could we increase that to the populations that we need to?
Thank you so much. Systems change.
Hi. Okay, well, this is a pretty big topic, and a couple things we discussed that there's multiple systems, funding, government, and then also what are we trying to change? Is it policy? Is it fragmentation? And the fact that those with funding often drive what we do. So how do we prioritize that? So what we kind of discussed was this notion of a systems thinking training academy, and not just for nonprofits, but something that brings in all these sectors, government, funders, employers, etc., where we can, it's kind of a forum where we can come together to address a particular system across all the sectors. And within that, the ability to sort of find what models are really working and why, and then be able to share that with these groups, and really be able to align within that, align funding to the strategic priorities and to these things that are actually working. So I think that's kind of, I think that sums it up. I'll take it.
So we got a lot of great ideas. There's a lot of information up there. I think I tweeted, as you can see, that I am so impressed with the ideas generated by all of y'all. And I was thinking about, well, how are we going to do this vote, right? And I just wanted to go back and talk a little bit about and remind you that the reason we kicked this off, do this conference, is to really begin to create innovation and begin to create innovative ideas. And yet, as I looked around at the outcomes, I saw two things. I saw some that really rose to the level of systems change, of innovation, really big ideas that are going to make a huge difference across the board. And yet, I was also reading some other things that I thought, wow, that's really important. We can't lose sight of that. We really need to capture that and make sure that we continue to work with that particular idea. So I just wanted to let you know that that's what we're going to do. So I kind of changed up the use of your dots as I was looking at this. So what we're going to do next is have you put your dots on these pieces of paper, but mostly at the outcomes, not about the other kinds of discussion that you'll see up there, but about the outcomes that people identified as being high priorities. Use your green dot. Use your green dot for the idea that you think is the most innovative, the one that really rises to the level of systems change that you think is the most important, right? So the big one, right? Your orange dots, I want you to put your orange dots on those other ideas that you think are just as important, even if they don't rise to the level of being a systems change idea. You got that? Green dot is for big idea systems change, right? Orange dots are for those that you think are just as important, but maybe they're not systems change, right? So head away to the boards. Well, this is very interesting. Very interesting. I see 6 green dots on collaboration. I see, ooh, lots of dots over here on coordinated integrated health and social services. Lots of dots, green and orange. I see 5 dots right here on HIV. Y'all just kind of like put them over here to the side so they're not exactly on any one number, but the benefits of testing and early detection and collaboration and information exchange to facilitate systemic changes. Ooh, systems thinking and systems change. Training Academy. Wow, we have got some really great ideas up here. So here's what's going to happen next. I'm going to do this little part, and then you'll do your little part, James, and then I'll do my other part. Yeah, okay. All right. So, oh, yeah, I've got some slides now. But so the follow-up on all of this is going to be that we're going to continue this discussion. I'm committed to continuing this discussion. In the evaluation that you will receive, you will have all of these 12 topics. You'll have the ones that got the biggest number of dots, and you get to volunteer and tell us which ones you would like to work on, or tell us who else needs to be a part of this conversation that didn't get to make it today, or that you think should be a part of it, maybe didn't even know about it, right? So we're going to ask for that kind of input as well. When we get those items that, and enough volunteers, I'll convene the group, and we're going to do the deep dive into the data, into the information. We'll craft up some solutions, try to test them out, and see what we come up with and see where we go from there. So that is going to happen. On the orange dots, there's a couple of things that I can see are going to happen with the orange dots. One of them may be that we convene. But I also noticed that in a lot of those orange dots, there's a lot of work already going on in our community around these particular topics. I don't need to recreate another group of people to meet to talk, right? So what I think is going to be really good, and I'll need your help on this as well, is to get this information to those groups and say, here's what this group of people thought was really important. How does this fit into what you're doing? Is this something that you also want to take on? And let's see if we can get groups to kind of take on and adopt these ideas that you've identified as really great ideas. The other thing that I also see happening, and I talked to a couple of my board members as y'all were coming up with all of your ideas, they're really going to help us be informed about where our dollars go, what kind of work we want to deploy into the community, and the work that we want to see happen because of the feedback that you've given to us. So there's a lot of different kind of steps that will be going on along the way with what we're going to do with the information that you've provided for us, and I really, really appreciate that. So James, the next thing I was going to do was kind of go into what the innovation initiative is and blah, 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 blah stuff. So I don't know if you want to you want to end with okay. That's how you do these conferences. You just kind of go, what do you think? Yeah, that's what I was thinking. Okay, good, we agree. So flipping forward, oh, another more, come keep going. There, one more, there, go back. One more. No, the other way. This one. So just to tell y'all about the types of awards that we have at Alliance Healthcare Foundation, the Big Innovation Initiative Award we've talked about probably too much today, but it's the one that's kicking off today. The applications will be live tomorrow, at least by tomorrow, so that you can start looking at what the information is. We have our mission support grants that we just gave out in February. $1 million that we distributed, 29 organizations, 24 in San Diego County and 5 in Imperial County. So we're excited to have more of our grantees, welcome you guys, from Imperial County to be a part of our whole mission support cohort. And then we also have responsive grants. And I don't know how many of y'all know about these, but responsive grants are the grants that are open year-round. They are up to $25,000. And they are the grants that we try to be responsive to the immediate needs that are happening. Kind of, we'll do things like, recently we purchased new ovens for Mama's Kitchen. Their ovens broke, they needed new ones, we've done that. Bayside Community Center had started to, wanted to provide frozen foods and meats in their food pantry, and they needed freezers. So we bought freezers. We also use this for leadership development and organizational development. There was a woman in our community as an executive director who had been accepted into the Stanford Executive Education Program and needed a small amount of money more to complete the fees that she needed to be able to enter. And we used it for that. We've also done strategic planning efforts. So the theme that you'll see is that they're one time, typically. They're not going to be doing this every year or every month. It's not for your ongoing fundraising. That's more the mission support kinds of things that we'd want to have there. So if it looks like kind of your ongoing fundraising, your new program that you're trying to start up, you're trying to get the funds for, that's not going to be qualified for the responsive grants. If you have a question, call me, call Michelle. Call Michelle, and we'll talk you through it and tell you maybe a way that it might be able to fit into a responsive grant. So those are the 3 types of awards that we have. In our innovation initiative, next slide. That direction, yeah. In our innovation initiative, whereas you can tell, we're always looking to advance health and wellness. We're looking for innovative approaches and those that serve the most vulnerable population. So under 250% of poverty, those who are uninsured and underinsured, the homeless and children are our target populations. Next slide. Y'all could probably tell me. So we've talked a lot about it today, so I'm not going to spend a whole lot of time on what is innovation. It's systemic change. It prepares for the future. It impacts cost, quality, and or capacity. And many times what we're looking for is data to support the idea. Sometimes the data needs to be created. So your innovation is that you're trying to get the data to prove that your idea is the one that's most important, right? So sometimes it is to create the data. But it is systemic change, preparing for the future. It's like you're saying, I see this coming, and I think I need to do X, Y, and Z to prepare for that. And so this is what needs to happen. We've tried to give you some ideas throughout the day. Where does it need to be? Where does it need to affect? Yeah, there it is. The 2 southernmost counties of California in San Diego and or Imperial County. Now we will fund an organization outside of this area, but the work has to be done in one of those 2 counties or both. Main thing, really important stuff that you need to know. Today kicks off the application. It's open online. You can go and look through it. You don't have to complete it. You can see what the questions are. I am going to do, because I'm not spending a whole lot of time on the details of the innovation initiative today, I am going to do 2 webinars. They're next week. I thought I'd try to get them in early so you could get started thinking about what you're doing. The first one will be Monday, March the 30th from 10 to 11. You can, hey, Kevin. Oh, Kevin's not in the room. John, do you know where it is? Is it on our website, the link? Oh. Got it. So we've got a link, an email that's going to go out today at 3 o'clock. So by the time you get to checking your emails, it should be there when this is done. There's also going to be a blog post. So there's a lot of different ways to find out how to sign up for it, how to get the information for the webinars. So Monday, March the 30th, 10 to 11, and then Friday, April the 3rd from 1:30 to 2:30. If you can't make one of those, don't worry about it. I'm available. Email me or call me and we can talk through what the questions are. Ask me any questions. I try to be as available as possible. And as you come up with your idea, it's also, I think, helpful if we talk about it and I'm able to kind of help you fill in some gaps that I think the board might be interested in. Now, I can't answer all their questions, believe me. They come up with questions, I'm like, whoa, where'd that come from? But I try to get as many of them as I can and help you in terms of your process. The online applications will close on May the 6th. So you have about 5 weeks to complete them. Notification of participation. Our program committee will go through all of the proposals, and they typically have been selecting 4 or 5 to go forward for the board, the full board to hear. Now, this is where it's a little bit different. On July the 17th, we do our Pitch Fest, and it's much more like a business plan competition. You ask Scott how it, oh no, you didn't do it. You can't ask Scott. But you actually, we will provide for you a consultant that helps you develop the presentation. He tells me that when people come in, he says, so what's the problem? What are you trying to solve? It takes them an hour and a half to tell them what they're trying to do. You have 15 minutes. at the Pitch Fest to tell the board what you're trying to do. So he helps you get from that hour and a half to 15 minutes of the highlights and the important parts of what you need to do. Don't spend your time on heartstrings because you've got us already. If you're all the way to the Pitch Fest, we need to see what your business plan is, what your model is, what your marketing is, all of that. And the Pitch Fest will happen on July the 17th. The board actually has every year except one made their decision that day. So I'm able to notify people either that day, depending on how long they go, it's a Friday, or over the weekend or on Monday to let you know that you have been selected as the awardee for our Innovation Initiative of 2015. So any questions about that process? All right, turn it back over to you.
My back on here. Yep. So it's been a long day. Thanks for hanging out until the end. The wall is beautiful, I think. I mean, amazing contributions, a lot of ideas put out there. And I really look forward to seeing who takes these forward, you know, who takes ownership of these things and where they go in terms of organizational collaboration and the innovation that Nancy is talking about toward the competition and to your work individually and organizationally. To finish today, and remarkably, we're on time. We haven't gone over. I want us to do just takeaways, reflections, and sort of closing out of the day. And I know some folks have had a chance to share from their position as moderators of these discussions. But now that we're back in the circle and we can pass this microphone around to whomever needs it. Your feedback on the day, something interesting you heard, something provocative you heard, something unexpected that came out, whatever it might be, your reflections on the day. And ideally, if everyone has a chance to speak, that's great. If we don't get there, that's also fine too. So would anyone like to start?
Education is essential for everyone, and that's why we didn't get up and talk.
Thanks.
Just a very quick comment, a really nice day, but I think certainly for me, and I hope a lot of other people, the concept of collaboration and working together and getting to know a few other people here that are willing to do that, partnerships and whatnot, is a really good thing for everybody.
Who's next?
A quick comment, and I have to defer to the handsome man in the back there with the hat on, whose name escapes me right now, but he really made me think a lot about the whole aging process, because that was our first topic, and how we as a community and as a culture really need to change our thinking about something we will all face, and how we can embrace those that are aging as being, you know, critical assets in our community and do it with grace and dignity.
Thank you.
It was such a pleasure to hear so many voices and hear all of the good ideas that came from the group instead of just a few talking heads up on the screen. So thank you all for sharing your good ideas. Nobody was shy. Everybody had good ideas, and I got to meet some really interesting people. So thank you all.
Who's next?
Just reaffirming what a lot of people have said. I was very struck by the spirit of collaboration. And also, it just strikes me how sort of energizing it is to know that there's all these wonderful people with the same sort of cares and concerns doing wonderful things in San Diego.
I would say that often my experience is that it's not always the solution that is brilliant, but it's the questions that allow us to open up to brilliance. And I brought a lot of questions, and I'm leaving with a lot of questions. So I'm grateful for that and for the opportunity to be there with you all in it. So thank you.
Where else? Where am I going with this mic?
I've really enjoyed the day today, but just seeing the incredible amount of overlap and how we're all working so intensely on these topic areas. It's exciting to see that we could really better the places for the citizens of San Diego, and it's been inspiring, and it's good to get re-energized sometimes by these types of collaborative meetings. So I just want to say thank you for you all taking the time out as well to be here.
Anyone else? Going once? It always happens.
I think all of us know that all the work that each of us does is really interrelated with the work that everyone else does, but it's very easy to forget that. And something like this makes it really very clear just how often our work intersects and just how much the work that each one of us does helps everybody else.
Anyone? Nancy? Anything?
So I would, you know, reiterate everything that has been said here. I think it's so important for us to hear the voices in the community and for us to hear what it is that you think is so important about the work that you're doing, about the people that you're working with. Because now in this role, I'm not in the provider role anymore. And it's just so refreshing, rewarding, and I hope that you will see that we do something with this information and that we will turn it around and do something back for the community in working with you and in partnering with you. And I just so appreciate that all of y'all were here, that you shared such insightful thoughts with us, and that you shared that with each other. I was really struck by the conversations that were happening with each other as you learned about the ways that you might work together. And I hope that you also take the opportunity to further those networks and those opportunities with each other as well. Hold me accountable. Sometimes when you see me out in the community, say, hey, Nancy, what the hell happened with X? Don't let me slide. I mean, really, that's what I think will be most significant about all the time that you spent here and all of the insights that you've provided, is that we hold each other accountable to getting this work done and to moving these issues and these ideas forward. So again, thank you all for being here. Thank you for sharing your day, your time, your thoughts, your insights, and just your smiles and being here with us today. I really appreciate that. Thank you. Thank you, James, for leading us through all of this. Really appreciate that. Thank you to my media team back here, John and Kevin, wherever Kevin's hiding. And I cannot say this without saying a thank you to the staff. Michelle, Laura, who came in as our temp and just said, oh, I'm doing a conference, awesome. So Laura and Michelle, thank you all so much, I appreciate it. And they're not even out here. I should have done that sooner. But yes, absolutely. The people that served us so graciously throughout the day, making sure everything was available and everything. We really appreciate all your help in the kitchen. Thank you.